So there'll be a link in the chat that just the initial ones, and I'll look for others that I was aware of. Thanks.
Great, thank you. Well, good morning again. Let's get started, and Happy New Year. I hope all of you had a good restful break and go right back into it. It's already middle or towards the end of January. Got a couple more weeks. So today we do have a very specific agenda. Lots of interesting discussions around informatics. We'll spend a little bit of a few upcoming events that are related to informatics next few months. And then what we like to do is Steve, Wilkinson, Julia, Chevan, and myself and Eric Toole, we've been working on this concept analysis of health informatics, and we presented this in ELC this past year. But what we like to do is bring this back, and we'll present it, but we're really curious and interested in getting your feedback and your lens, and grow together in this informatics space. And then if and when, or hopefully if you have time, we can talk about some of the upcoming events, and some of your ideas and some of your thoughts of what projects that you may be interested in working on and bring forward. So some of the upcoming events for this next few months, there's a Learn Ground Round series. I don't know, there's already this past week, I missed it, but these are all recorded. So I would encourage all of you, if you haven't checked out yet, this is the link, we'll send it over. But I think this spring series is around EHR data, informatics, data standards, lots of stuff that's within our wheelhouse. So anyone here has attended this past week or last week session?
Yes, I was on it.
Yeah, Julia?
Yeah, it was excellent. It was Dr. Michael Kahn, who I think was out of Denver, and talking about some of the pitfalls, things to be aware of, particularly when you're trying to pull data out of Epic, and just the structure of how it can be very difficult to extract data from systems like that because of the structure, the way it's organized. And then I believe there's a training tomorrow. Do people have information on that?
Rick, if you would put it in there in the chat box for
yeah, let me do that, because I'm pretty sure. Yeah, there is tomorrow.
Yeah, all the Learn Grant this year, or I would say this session, most of the Learn Grant rounds are really very tied to informatics content. They're worth going to, and all of them are archived, so they'll be available on the web after the fact as well. And there is another one, I have it on my calendar, I can tell you what it is, but they're really easy to sign up for and get the notifications. So the one tomorrow is called investments by the federal government in electronic health record repositories in the research community.
It's Jacob Keene.
Yeah.
Right, Jacob Keene. And I just put the link in there to the Zoom. You might have to register for that.
You do.
Yeah. Let me see. I can probably, you know what, Bob, let me look. I bet I have the information about registering for it. What if I send it to you and you distribute it to the group? Would that work?
That would be perfect. Yep. And I'll also get it to Madeline. We'll put it on the website. That'll be for tomorrow and for the other ones too. And just so people know, Rick is one of the grantees underneath that program and has done a lot with it. Thanks. I'm not sure who else is involved with that. Julia, it sounds like you are.
Only peripherally.
Yeah, this is great. Thank you so much, Rick and Julia, for putting this down. So any other events? The ones that the CSM is coming up in about a month, and the HIMSS. But if there are any events that you would like to share, you can forward it to Bob or myself, and we'll post it and we'll share it, we'll disseminate it. I know that Stephen Hunter he is going to be speaking for our ground rounds at UCSF next month. So if all of you, if any of you are interested, I think you just need to register, but it's open to the public. That's one of the many events that are upcoming. And then any updates on IRC website? We did post a few videos, but any updates, Madeline, from our website?
I just added a couple events last time and added a couple people that I had forgotten about from sort of December, but they all should be there now.
Great. Thank you. And if you have suggestions about what should be included in there, I know there's especially under the resource section, it's work in progress, and we would love to get your feedback. Please send us your feedback to Bob or myself or any of the Madeline, and then we'll take that suggestion and then take it back to our committee. So I'm going to stop here because we are going to talk about the concept analysis work. And Julia, you know what I'll do is I'll put the slides up. Yeah. Yeah. And then why don't I send all of you the link to the paper for, if I can see it here. Did I send you the paper? 1 second.
Did you get the link I sent you? It has the DOI, Sam?
Yeah.
Okay.
Here you go. All right. So let me. 1 second. I will put in the slideshow. And here we go. Okay. So I sent, there is a link to the paper from Jati, and a lot of this work is really, it's amazing because, a lot of this work has been stemming up from this gap that we saw around our education. But from our education, you can see the gaps kind of trickling down in the clinical world too, and in our healthcare. But we saw that there needs to be a clear defined or understanding what this CAPTI's requirements are for informatics. And if you look at the paper, we saw that there is almost literally a one-liner what CAPTI requirements for our education is. And I know this is something that we need to revisit and consider, and we talked about this at length at ELC. But use of health informatics in healthcare environment isn't quite enough for us to digest and be informed in our curricula. So how do we do this? Before we began, we actually asked our audience at ELC some of these questions to better gauge some of the faculties, administrators, and some of the staff who are supporting in their curriculum, in their respective areas at ELC, and just put in some words and some of the thoughts that bubbling up from their perspective. And we put together the word cloud, and a lot of these word cloud data or the responses that we got, what is informatics? What should be components of informatics? There's big data analytics, outcomes, communication, population health. These things that are big words, not unfamiliar. They're within the realm. But how much of the informatics should be taught in our curriculum was another question that we asked our audience. And we asked them to rate it between these 4 statements? Should it be taught in a single lecture? Should it be taught in a single course within a professional curriculum? Or would it be just simply easier to just have an expert teaching this in our DPT curriculum? And interesting enough, vast majority of our participants that this should be taught within a professional curriculum. So how do we do it? How do we implement this? And I think this is where a lot of this work, at least the beginning of it, is stemming from. So Julia and Steve, we're sort of going to do this very ad hoc. So feel free to chime in. Anytime, but I'll keep going if you
Keep going, Sam.
Yeah. So we did a concept analysis, and why did we do the concept analysis? And you'll see that, gosh, I mean, some of you already know. Can you just use one definition of health informatics and apply it to everything? I mean, is there such a gold standard definition? And would that really inform our curriculum? Would it inform your practice? I think that's really difficult. So concept analysis would help us, specifically because it really clarifies the characteristics of the concepts, and we really think about like two concepts like anxiety and fear. Can you differentiate the two? Because oftentimes they're used interchangeably, but they have the similar physiological response, but they're two different concepts in general. So can we use concept analysis to help clarify what health informatics is and examine the structure and the function of the concept? And we use Walker and Avant specific methodology. It's been used widely more, especially in the nursing. And the field of nursing have really done an excellent job doing a lot of concept analysis. And 8 steps that are required in Walker and Avant methodology. Very specific, very systematic, from selecting a concept to determining the purpose. And I highlighted the next 3 steps, because a lot of our the meat of this work and the findings and the new discoveries were really evident through these 3 steps. Not that any of the steps are not important. It's just identifying the uses of the concepts and determining the attributes. And we'll explain this in a few minutes. And then coming up with a model case. What does this really look like? Can you give us an example of what health informatics is? Especially in a curriculum. So I could keep going, Steve and Julia, so you chime in anytime.
Sam, do you want us to jump in? You're doing great, so
Yeah.
I'm just letting you go.
So yeah, go ahead, Steve.
Well, I'll just jump in, and then you can elbow me out. It's when you get sick, you hear my voice. So this attributes is when you think about, we found 73 definitions of informatics, and so what we did was we found attributes which were most frequently associated with the concept, and hopefully it helped bring more insight into the concept. And this is coming from Walker and Avant, of course. And so we looked at each of those, and we picked out the attributes of what each of those definitions were saying. Then you can advance slide for me, Sam. So back to our methodology. Essentially, we had I can't remember the number, maybe it's the next slide will tell us, but we had a bunch of articles. And so we looked first at articles that included informatics, and then within those articles, we had to make the decision, was the definition related to healthcare or other types of informatics, and then did it also contain a definition of the term informatics. next slide. So Sam had put in that we started with 443 articles, and then from those we found 73 relevant definitions of informatics, which we then pulled the attributes from those 73 definitions.
So yeah, I want to say something about pulling attributes. It's really not quite as simple as, oh, and here's what the attributes are. This is really qualitative research, and it does have a defined methodology. And so a lot of this work was, we were a team of 4, each of us going off, reading all these definitions, reading all these articles, pulling out the content, deriving our own meaning of the content. So what you're doing in concept analysis is, the concept is health informatics. What are the major defining attributes that become readily apparent as you read through these definitions? And then are there any sub attributes or sub concepts within them? So we each did it independently, blinded to each other's results. Then we came together as a group and adjudicated every term and every concept and re-adjudicated it and shared it with people and have them help adjudicate it until we came to something that was conclusive, and the attributes we felt truly reflected the themes we read in these definitions of health informatics, medical informatics, bioinformatics, nurse informatics. And you'll see that in our concept map that we developed, we felt that that belonged in and of itself as an attribute, which is this thing called disciplinary lens. So not only did we do the concept analysis, but we developed this slide, which I'm going to turn it back over to you, Steve, if you want to talk, because I'll lose my voice in a second, which is our map. And we went through, as Sam said, lots of iterations and lots of conversations, and tried a true research, a qualitative research approach to being really exhaustive in the themes that we found in the definitions. Okay, go. This is the slide. This is the map. This is the big deal.
Yeah. And
Sam, Steve, you
yeah,
want to?
yeah, I mean, this is just a multidisciplinary lens. We'll just go through it, and we'll digest this together, because we really, we want to, as much as we are sharing our findings, we're also very much interested as going through the continuing iteration and getting feedbacks. But when we look at healthcare informatics, you'll see that multidisciplinary science. You'll see that phrase quite a bit sprinkled all over, and it integrates theories from many fields. It's never a one field, but it's multidisciplinary across literatures wherever we reviewed. The following scientific fields were most prominent, computer science all the way down to organizational science. The thing that really was interesting to me was we don't highlight the communication science. We think a lot about technology, talk about like computer science, but what about communication science? How do you communicate? How do you convey a lot of these? You think about EHR implementation, how many of those failed because communication was just deteriorating, around technology. And obviously the technology component is a big part. Multidisciplinary science of healthcare informatics involves the use of specific technologies. And generally, we can go on and on much more into specifics, but when we looked at our literature, the use of EHR is definitely there, but many forms of databases. Yes, Julia?
And the other thing is, if you go back to the big map, you'll see that technology is one of the attributes. Part of what we know is that in DPT education programs, the only attribute they're teaching when they teach informatics is right down this line here in technology. It's that they're teaching about EHR and that's it, and they claim to have taught informatics. And yet we're telling you, first of all, that we don't want it called health informatics or medical informatics. We think it's informatics in human health and healthcare, that it involves patients, caregivers, and populations, and that there are within that these 5 attributes: multidisciplinary science, data, application concepts, which are the verbs, disciplinary lens, which means that it may engage with the theory of a discipline, so nursing theory or medical theory or pharmaceutical theory. And then technology is an attribute, but it's not the be all and end all of informatics in health and human healthcare.
That's great. Thanks for pointing it out, Julia. Steve, you had a comment on that?
No, just that you guys are doing much better job than I ever could. So
Not at all.
I presented it again, you guys. I've done this. Yeah.
Yeah. So I mean, without data, you really can't start anywhere. So you need data. Data is all over the footprints of our review. And, health informatics incorporates multidisciplinary science using specific technologies to collect and generate data. That's pretty self-explanatory with the data collection, retrieval, and reporting. Bob?
I just have a quick question, and this goes a little bit, Julia, to what you were describing in the schools. Does this help to then identify, in essence, the gap that should be taught more as you're showing this slide?
Yeah, I mean, your question begs what you're asking us is what are we doing next, right? So
Yeah.
we're giving a model, and the model is a concept map, and we're arguing that the direction that schools have is insufficient because all they have is a definition of informatics, which is kind of a hazy definition of itself. So are we saying that what schools should be doing is working their way around the concept map? Maybe, we're not sure. Our next step is actually a validation study where we're going to be taking this map and looking at it in relation to disciplines that have defined competencies for informatics to see if actually it can be confirmed based on, here's what they say are the competencies, does that match up to what's on the map? And then the step after that would be to say, so what are the competencies that are really important within the discipline of physical therapy across the trajectory of the lifespan of who you are as a professional? Because is there one set of competencies that are important for the physical therapist assistant, a different set of competencies that are important to complete your DPT, another set of competencies that now build further if you're going to be a resident with a specialty or a manager or a owner of a clinic or whatever it is. So we're not done with this work. This was our first stab at saying, wait a minute, when we say we're doing work within health informatics, what is it that we're doing work in? And the map gives us the guidance. Again, every time we present this, that's part of our approach to we're validating the map. And we presented it at the Education Leadership Conference. I've actually presented it to a couple of programs that have asked me to come. I didn't tell you this, Sam and Steve, and do in-servicing work with them. And every time we present it, we're asking people, what do you think? Does this ring true for you? And if it rings true for you, our next step, as I said, is we're going to validate it against some things that exist, which are defined competencies for other professions. So does that make sense? It isn't the answer yet. It's the steps to the answer. There's never just, hey, we got the answer. And the other piece about concept mapping is one of the interesting things on collecting 73 definitions, and I think both Steve and Sam could talk about this, is that what you see in definitions is a historical evolution of informatics, which means that we may be coming back and revisiting the map in the future. I can only guess how informatics is going to evolve as knowledge evolves.
Yeah.
Well, thank you for that.
Yeah, anytime.
Love it. Totally on board. Yeah. Some of you are thinking AI, data science, machine learning, all that. Hold those thoughts, but I think that's kind of the evolution that we're talking about potentially here. And then there's another attribute, disciplinary lens, as Julia's mentioned, going from lots of different unique disciplinary lens when you're using informatics in healthcare, and all the way from clinical to social work. And not surprising, as we see, just go plunge yourself into any of this hospital setting or even outpatient clinic these days. It's rarely is in a single siloed discipline.
Yeah,
and then
in a way, the idea of disciplinary lens is actually, if you think about it, it's really a controversial statement we're making, because what we're saying is there may not be something called nursing informatics and medical informatics, even though those disciplines have claimed that in fact, there's a universal concept called informatics and health in human health and healthcare. And that you can take that informatics and combine it with the theoretical basis of another discipline and put that lens over it. But there's a broad concept called informatics. That's kind of controversial, actually. We haven't yet told our friends in medicine or in nursing that we see it this way. And I'm not sure that they see it this way because they have nursing informatics competencies, medical informatics competencies. And we don't think we need to have physical therapist informatics competencies. We think we need competencies with the disciplinary lens of physical therapy or rehabilitation or occupational therapy or whatever it is.
Yeah. And then finally, the verb. What do you do with it? What's the purpose? What's the goal here? And the purpose of using the information, in other words, how do you use the information that's been morphed, transform the data, for what purpose? And these are the key areas that data is applied to. And you'll see that education, communication, all the way to quality improvement for patient safety. So, so just a reminder that the 5 attributes that really expound on the characteristics of informatics in human health and healthcare: multidisciplinary science, technology, data, disciplinary lens. For what purpose in the application? So the fun stuff. What does this look like in our curriculum? So the question is, what does the model case look like? Steve can kick us off with this example.
Yeah, so Walker and Avant suggested these different cases, and so this is one that we presented in ELC. So health informatics and healthcare. So first, in their first year as a DPT student, you'd be introduced to HIPAA documentation, EHR navigation, and then the second year introduced the EHR reporting, documentation, and of course these courses include things like the High Tech Act, the EHR functionality, simulated EHRs, and kind of with the main objective to introduce EHR functionalities. And this is a case that, as Julie had already mentioned, a lot of programs think, I teach EHR with those components, I'm done with the informatics piece. And so we argued that this case, while is a piece of informatics, it's not the full picture. And so this isn't necessarily the model case. It's bigger and broader than just an electronic medical record.
Yeah.
So case 2. Oh yeah, go ahead, Bob.
I have a question.
No, it's just a question related, as you're describing the electronic medical record there, one of the things that I hope is shared at times is the reason for drop downs, or how that data can be more standardized if we're using certain language versus free text, the entire document. And I'm not sure if that's an accurate statement, but that's my perception with it. We just get a lot of questions within the company. Well, why can't I free text everything? And when they do free text everything, we no longer can compare the data across within certain reports and such. And so if we start at a academic level within the EMR and bring that up, maybe it helps us, as we're working towards standardization.
Yeah, Bob, that's a great point.
It just comes up with what Steve was just starting to mention there.
Yeah. Yeah. I think we got to start early on, and this is why we need to talk about this. And but absolutely, we need to start early. Why our students generally, that's not on their radar to study. I mean, when we bring up, you look at the data standard, we lose almost everybody right away. But we start to incorporate kind of the use case and kind of look at the spectrum. You're collecting range of motion, you're collecting some of the chronicity, these impairments. How do you actually give me, when you actually paint that picture, collection, storage, and reporting, you have to let them see that. And there's different strategies, different ways to get that in an early seed in their DBT students, but we'll hold those things a little bit later. Steve, I'll go ahead and have you resume here.
Yeah, you can switch slides. So this is another case we presented where the DBT program again provides early exposure to the basic concepts of informatics and human health and healthcare, and includes all the 5 attributes that we described. In the first year, the highlight of those attributes would be data, technology, and application. And to your point, Bob, when I've presented this to my faculty and said, hey, we need to do a better job so I'm not a hypocrite when I'm, talking to folks, we need to be doing it here at Rocky Mountain. And so I provided them examples, which I think are further down in our slides, but even in things in those early courses when they're learning about range of motion measurements and where do those go and what happens if your measurement is really off, if you put it in the EHR that has some decision support or validation, it can say, hey, wait a minute, are you sure that this range of motion is what you meant to put? And also, if it's not put in that place, in the right place, you don't get that kind of validation. So yes, and then the second piece of that, so, getting to your point, Bob, but the second piece is about, saying that this is informatics, because if we just talk about it as, oh, I need to put this into the EMR, and there's a reason I put it in this place. And, if we're going to do validation studies or research projects or quality improvement, they need to be able to find that data. And by the way, this is informatics, to start connecting the dots between these maybe these elements that the students may not be associating with informatics. And so that's the main message to my faculty is you're teaching a lot of this stuff already, but you're not making that connection to informatics. And that's what I need you to do. I'm not asking you to add more content. I'm asking you to use the content you're already teaching, but adding the connection of the dots. And so second year, we continue with what we taught in the first year, but now we're adding more emphasis on the application pieces. And then at the end, most of our students have their terminal experience in clinicals, and that's where hopefully they put everything together and they're ready to hit the ground running and understanding that part of their lives as PTs are going to have informatics as part of that. So it's a broad, and here are some of those examples I talked about in certain courses. So data, of course, in research methods, you talk about, big data, et cetera, and using quality improvement, et cetera. And I'm not going to go through each of these examples, but hopefully you can see here's a second year curriculum. Most of those courses turn into clinical courses. And then again, trying to emphasize that we're using informatics and connecting those dots to informatics without adding additional content to curriculum. And then third year, again, is the terminal clinical experience.
Yeah.
So,
yeah, go ahead. Yeah.
I guess this is where we open it up for questions, or is there Julia or Sam, do you have anything to add? And then we can maybe open up.
Yeah, I'll just say that thank you, Steve, for sharing the model case. I think for me, I think Julia, it's the same message. Oftentimes when we think about informatics, we think it's easy to just say it's all about technology and EMR. And that's it. But this map informs us that, actually that's incomplete picture. And that's why these attributes they're required to paint the picture, the holistic picture, the completed picture. But I would say complete in that it's in an ongoing fashion, this is why technologies evolve, cultures evolve, things evolve over time. And we saw that in the literature from the 70s to 80s to 90s. And this is like not just in the US, but internationally all over the world, and how that transformed. So it just helps us get a quick snapshot that, contrary to what perhaps our biases think about informatics, technology is really important, but it's not in itself in informatics.
So for everybody else on the call, how many, this resonates with me. Does it for others?
Yeah, Stephen, absolutely. This is great work, man. This is really awesome. And I love this. I love the way you've done this map, because, again, I'm not, I really consider myself an informatics novice. I'm not at the level that you all are, but I do understand a lot of the things that you've listed here, because I think informatics maybe has an identity crisis. I think people don't understand it like this at this level to help them know, the definitions are, of course, my interest is in technology application, but I just think that this is great stuff. And I think if you can make this, kind of sexy, appealing to students, then, I'm here just jotting down how we could create a third-year rotation in Intermountain in informatics, because I think this would be a great experience to see for a clinician how it would fit into providing better clinical care. So again, the only other thought I wanted to share is, if you go with this with a student that says, hey, we're going to talk about HIPAA, we're going to talk about EHRs and documentation, they're going to go, I'm not interested in that. That's like boring. But if you talk about that, and then how that leads to them being able to use the documentation, the EHR, AI, to prompt them to do better clinical care and give them real-time feedback on how they're doing with that patient, with Mrs. Smith, that's what they hopefully care about, then I think they're going to go, okay, whoa, I get this. I see how informatics, what you've determined in human health and healthcare, can really help me make better clinical decisions with my patients and better engage with my patients.
Yeah.
So
That's great. I gotta say, you've made so many really helpful points and important points, because what you're talking about is bouncing back and forth across the attributes when you're working and teaching with students. So you're right. I mean, I teach HIPAA content and I teach some of that other content, and they get it. They have to know it, but man, this is the dullest stuff. But if I then walk across the map and say, let's talk application. Let's think about this from business decision-making standpoint, or what you talked about, improving outcomes, improving your ability to make a decision. Good for you for following HIPAA. Next step, you have some data, you've followed HIPAA. How does that inform your ability to make decisions about your business, your patients, quality? How does that help you to detect when there are blips in the lifespan, in your clinical lifespan, or blips in the care of a patient, or someone's doing something really extra special and very well, and you're not picking up on it until you look at that? Kelly, of course, says it's all about informed decision making. Yeah, Kelly, I didn't know you were here, Kelly. That's a great. Yeah, exactly. Yeah, and the tools that you need. So, I mean, that's why we felt like what informatics doesn't need another definition. It needs a map, and it needs us to guide students. I like the way you said it, Stephen, because you may not have realized you said it, but what you were talking about was taking students around the map over and over again and not sticking them down one thing and saying, hey, you met the objectives of your DPT program because you learned what HIPAA is and that there are electronic health records.
Yeah.
That is so great. I love the third-year rotation. Can't wait to send you 5 students.
Excellent comments and responses. Ching, you have a question?
Yeah, I just have a comment. I think you guys did a fantastic job. And I just shared the article to our faculty and saying we should do it, we should implement it. Because at the very beginning, when we designed this new program, and then people are saying, oh, we have to meet the requirement, so we have to talk about health informatics. It should be in our curriculum. But no one lifted it up, just saying, oh, this is part of the requirement. So they said, oh, do you feel comfortable to teach about it? I was like, sure, because I learned it in a program. I feel like I know something. I read books, but when I look at the map, I was like, gosh, I'm missing some pieces for the definition, even just to give them the information about the data application, multidisciplinary technology. Didn't give them like discipline and just saying that. So I think it's even for like educator, we can deliver the different information now in broader terms to see a bigger picture for them. Students more they're excited to hear about new technologies because they feel like this is a new trend. They like to learn about apps or data or something is more sounds like a data, like a big data, but then they didn't hard to emphasize that we use this data not just to take the data, we use, analyze, improve the quality of care, and how do we use it? That's the piece of health informatics. It's not just using it, it's analyze, look at our behavior, change our behavior, improve the patient's outcome. But that's what I'm saying. I'm looking forward for the next step because I'm looking forward you guys to. That's why I wish Robert asked the question what's it? Bob said, what's the next step? That's what my question. I was like, what's the next step? Because at least for myself as a kind of educator, I would like to see more about how we can implement or use it in our education, make it simplify, just kind of maybe a toolbox, this is for educators. So this is a concept we would like to help you to, would be more important to teach in this way, just to kind of some kind of bullet points or summary for us to kind of help us to implement in our education for DPT program.
Yeah. In other words, can you give us more model cases to share? Julia?
Yeah, or can we take a look at your curriculum and see and map your curriculum backward into this and say, here are some places where you could do some fill-ins, both things. That's kind of, that's great, Ching, and good, good for us to think about in terms of the progress on this. I know, and when I present this to people, what I always get back is, why aren't you guys moving faster? Bob, you're probably laughing though. I see you laughing about that because you know how long ago we set out to get started on this. Oh, yeah, why not faster?
And it may be worth mentioning right there that within the IRC, within the group that we started with, and we were all talking about this, I think it's been 18 months ago, 16 months ago, and we ended up with two different groups that came out. One that wanted to do things right now, let's get out there and make some things happen. And one that really wanted to say, look, let's really be clear about what we're going out there with. And we chose as a group to do both of those. So we split into these two separate groups. And it is, to me, it's fascinating to see the map that you guys put together, the description to how this all fits in. And I definitely understand those pieces within the world of technology and how fast it moves. Yes, I am always thinking, how can we do it faster? But that's not always the best way. And I think that this is proof of that. So just kudos to what you guys have done. I also would share there's two questions in the chat, one from Kelly. All the DPT educators in the group, is all of informatics need to be taught to DPT students? Do all 5 of these areas?
Yeah, so I want to clarify. Yeah, Julia's no, but Kelly, if I may ask, all of the informatics, are you referring to the, if I may ask, expand on that? Yeah.
So Kelly, I would argue that every and if you look at the model case that Steve developed that's in the article, every piece should be touched upon. But I think the real question is, to what level, to what degree? Exactly. And looking at the breadth of what is physical therapist education, and that breadth is PTA, DPT, residency, fellowship, and then the lifelong learner who's the physical therapist that is out there in the clinic and is knocking on Kelly Daly's door because they just joined Johns Hopkins and they don't know what the word informatics means, but everybody else in the rehab unit talks that language. So yeah.
I agree completely that you'd like for them to understand sort of what's the context, like what is this broad definition, what's included in it, and then understand which of these maybe we should go into a little bit more depth. So Ching, I say that partially for your benefit because you might be doing that all just exactly right. I don't know that all of every single thing here needs to be gone in. It can't be. That would be an informatics degree.
Yeah.
So the other comment, and I had put this in the chat, and it came from Ching's comments about students wanting to learn about the latest app or learn about the latest device. And I think that there's a lot of questions about that. Do those go underneath the technology umbrella? And if they do, then good and fine. If they don't, maybe where else. But the big thing I would encourage is that they connect that to how the data comes from those devices and how we use the data, like Stephen said, to improve the care that we're providing now with this person that's in front of me, right? Thoughts on those ideas?
Yeah, Bob, I think yes to your question. What we didn't do that in this concept map was add those relationships, because you're absolutely right. You could have a concept that could be put in here that could go under several different attributes. And so, that wasn't the purpose of what we were trying to do, but you're at, you think about a piece of data or, clinical decision making or quality improvement. Well, you need the data to make those decisions. You might need the database, under technology to make those, where you're grabbing the data from. So yeah, there's lots of relationships that weren't put into this concept map here.
Mhm.
Yeah, but I think the concept map has enough, maybe broader categories here that you can see where this stuff fits without having it listed specifically. I'm thinking here just of a project, and I think some of I hired a guy on my team, Chevan Christensen, who's an OT. I think Robert, Bob, Kevin, and he's an OT, but he's his job title is our technology expert, but he's really fits in a lot of these areas you've listed, because he's doing a project right now where he's collecting the tug on an application and with the patient's iPhone, and then putting it into a way that we can predict what their fall risk is, and then send them interventions to reduce fall risk. So it really fits everywhere in here. We're pulling data from the EMR, we're using technology to collect it. The patient goes home a month later and sends us another one with their iPhone, so we can see if that tug is improved. I mean, it fits in all of these areas, but it doesn't necessarily list specifically the technology or equipment he's using. But I don't think you need that in this map. I think anyone doing this can look at it and say, yeah, I see how the work that I'm doing fits in one of these areas.
I wonder, a lot of this focuses, and I like the focus on how the clinician is actually, like Bob was saying, entering specific information into the clinical record, and then how you can extract that information so you relate to what they're doing and how they can use those data for other purposes. I wonder if I know it's kind of in here, but does it need to be more explicit about external data sources? I mean, there's so much data out there, and that if people are aware of, if you have questions, you don't have to generate the information yourself or within your organization. I mean, out there, there's all kinds of databases out there in general. I mean, I think it might talk about databases, but to emphasize to people that information the answer to your question might already be out there, and what you have to do is pull that information together and extract your answers from it.
Yeah, that's a good point. Thank you, Rick. Yeah, absolutely. I mean, you don't need to always have it in-house internally with collecting the data, census data, registry data. There's CMS has a data set, many kinds. Certainly you can incorporate that.
Sam, there's another great question in the chat Kelly put in. I know that you guys published this recently, or it's coming up to be published. Is there a link available to the paper that everybody can get, and in part so that people can share this with others that or if you are working with a PTA that comes in that says, hey, I'm interested in informatics, take a look at this and let's talk further, or begin your conversations, just some way that we can all maybe use this as a basis so that we are level setting out there. I don't know.
Yeah.
Julia just put it in, I think, for everybody to see. So thank you.
Yeah, sorry, it didn't go well, but it's in Jopti, so it's behind a journal paywall. It's in there, published online before, so it hasn't, doesn't have an issue yet. I mean, Kelly, the idea of publishing cases is that would be another approach to validating the model, right? So here's a case, does it validate the model? Or here's the learning that happened and the capability of the students when they went out into the clinic, that validates the model too. The more we can do to validate the model, or better yet, invalidate the model and change it, because isn't that really the world we're looking for? I think better for us as researchers on this.
Yeah.
But I'm not sure if you were here, Kelly, when we talked about how we are moving into next steps with it, which are validation steps. So
no, thank you.
Yeah, and that'll take us another year or two. So stay tuned, because man, we do this work at the pace of a
Brian, you look like you had a comment there. No? Okay, just making sure. And Madeline or Roland, Chris, Jen, you are ones that I didn't hear. I just want to make sure if anybody has any other questions, comments.
No, I was actually diving into the article. I think it's super interesting. I love it, especially as we're thinking about how to modify our curriculum a little bit to include those sorts of things. I did update everything that was put in the chat is on the Google calendar now. So all the CSM are not like individual ones. If you just click on CSM, they have the links to the informatics things on there.
You're awesome, Madeline. Thank you for keeping that website up so much and just great. Thank you. Chris or Jen, anything from either of you? Or Roland?
Okay, this is Jen. Thank you, Sam, Steve, Julia, for presenting that. Oh gosh, you guys are always so inspiring. And just, even today, as I get an email from one of our therapists in my health system, just saying, how do I get interested and started, or I'm interested, how do I get started in informatics? And it's just, I think laying this groundwork early and the work y'all are doing is just amazing. So thank you.
Wow, Jen got the same email I got. So echo those comments. So I'm sure you guys are all getting that as well. So thank you.
Wonderful. That gets
Awesome.
us fired up. Mhm.
Sam, I'll leave it to you to wrap us up. We're right at the top of the hour. I just want to be respectful of everybody's time. And I do want to really say thank you guys. You, Julia, Steve, everybody else who worked with you on this, anybody else, just awesome. Thank you.
Well, we thank
Thanks
you
for presenting too.
Oh, absolutely. And thank you for the community. I mean, this is a collaborative nature. Obviously, the very existence of our group is centered around knowledge sharing, dissemination, and innovation. So we look forward to keep collaborating and send us your thoughts. Maybe you have some in mind and you want to, perhaps this would be one of the groups. So we welcome you and we thank all of you for another session, and then we'll go ahead and send out for next monthly meeting topic, and then we'll go from there.
And our next monthly meeting, I believe, is the week before CSM, just so everybody has that. Okay, thanks. We'll talk more.
Yeah, thanks everybody. It's a great session.
Thank you, Stephen.